Lisa, what programs in Canadian students, among the Canadian students, are being popular at your university?
We tend to see a trend of pharmacy students and law students from Canada.
Pharmacy
and law.
And law students.
Yes.
Okay.
So pharmacy in particular is hugely popular in Canada, or in Canadian students coming over to the UK because of our setup.
Okay.
So we offer what's called an MPharm, and that is a 3-year bachelor's, which then automatically leads into a 1-year master's.
MPharm?
MPharm, Masters in Pharmacy. So they'll start off in year 1 of an undergrad and finish 4 years later with a Masters in Pharmacy. And that's slightly different to the way that it's offered here in Canada, in that it's a quicker route, so to speak, but allows students to practice as pharmacists back here in Canada once they've completed a pre-registration year in pharmacy as well. They've got some kind of pharmacist practice.
Wow.
So we do see a huge trend in pharmacy students, law students, as I mentioned. So a lot of students like to come over and pursue a bachelor's in law or human rights law or criminal law, which we offer. And then we'll start to see a few art and design students here and there, but pharmacy and law tend to dominate for us, and luckily we offer both and have Canadian students studying both.
Wow. So how many places for pharmacy per year do you guys offer?
It's not necessarily that it's limited. We can't recruit kind of 100 students onto it, for example, because a lot of our placements are done in the NHS and in GP surgeries and hospitals, and they have limited resource. So we would probably cap it at around 40 to 50 international students. However, places do run out quite quickly because there's such demand for it. So if there are any students wanting to study pharmacy, don't leave it to the last minute. For a September intake, I would make sure that an application was in and completed by February at the latest, 6 months prior.
I think there's also an interview element in pharmacy program as well.
Okay.
Comparing to other like law program where you make an application and you got an offer, so you're ready to go, for example.
Okay.
Whereas for pharmacy, it takes an additional element of interview, which you need an additional preparation as well.
Okay.
So it's better for pharmacy program that you should apply as soon as you possible, and of course to make sure that you're among the 40 students as well.
Wow. Wow. Yasir, tell me another thing. This pharmacy program is part of your healthcare program as well, or that is a separate program for your students, like nursing, medicine?
So that's separate. So we do offer nursing. Yeah, we offer nursing programs as well. Medicine we don't, but nursing we do.
Nursing
pharmacy.
you do?
Yes.
Okay.
We have pharmaceutical and cosmetic sciences, which is actually quite popular.
Okay.
It kind of looks more at the creation of the drugs and the medication, as opposed to pharmacy, which is a bit more patient facing.
Yeah.
So we do offer those, and they're all separate degrees in their own rights.
Yeah, the reason I asked you, Yasir, I'll come back to you on that one. The reason I asked you about the healthcare and nursing, because there's a huge demand in Canada for nursing, and to my knowledge, all the universities are unable to fulfill that demand. So guys, this is a great opportunity for you to join DMU at a very low cost, at very reasonable rates, and also you're going to experience a totally different culture. Not totally different culture. We've been there. They've been here for a few hundred years. So we know the culture, but we're going to experience it in a different way. So please don't hesitate to call Yasir Bhai. There is a number at the bottom of the screen.